Hey everybody, what's up? This is Dr. Craig Kasper from NYHD and the Institute for Hearing and Balance. We're back with another Audiologist at Home episode. And today I have back again Dr. Alexandra Zweig from
Hey,
all the way from Brooklyn. How you doing today?
far in Brooklyn. Pretty good. How are you?
I'm doing well. Happy Friday. I know we talk about we don't know what day it is anymore. We don't know what time it is anymore, but today is Friday.
Yeah, and it's going to be a nice weekend, so get outside.
Yes, it's Sandy's birthday actually on Sunday. So
Oh, happy birthday, Sandy.
thank you. I'll let her know.
Yeah.
All right, so today we're going to be talking about a topic that gets a lot of attention, and we've done some things on this before, tinnitus.
Yeah.
So we're going to kind of bring this down to a basic level again, just for anyone who is kind of looking at this for the first time or just starting to learn about it. And the question is, what is tinnitus?
Okay. So tinnitus is a word we hear very often in our clinical setting because it often has to do with the auditory system. But I'd say also because we are a tinnitus center, it's something we deal with daily. Today, I'm going to talk more about the information about tinnitus, kind of fact, rather than the emotional components or treatment. If you're interested in those components or learning more about treatment or management, we have one other video by Dr. Naeem, which we can probably put up here if you want to take a look at some management techniques. And then we did an interview with Dr. Jennifer Gans, who's a psychologist, and she deals with more of the emotional standpoint. So I'm just going to remove that from today's video.
Yeah, we'll
So
link that up in the YouTube video so everybody has a nice, easy way to get to it.
yeah, for sure. So, what is tinnitus? Tinnitus is a phantom sound that is perceived by the ear or in the head when there's no external sound present. So, that's kind of the basic definition of tinnitus. It comes in many forms as far as what sound we do perceive. The most common sound is going to be a ringing. Some people will describe a buzzing, a roaring, humming, clicking, whooshing sound, sometimes a chirping. Those are all sounds that fall under the category of tinnitus. It affects probably about 15% of people, so that's millions of people. We've all heard our friends say they went to a concert and left and had some ringing in the ear, either for a few seconds. Sometimes it affects people a little bit longer than a few seconds, maybe some minutes to days to more chronic than that. And it is a symptom of, generally, tinnitus is a symptom of an underlying cause.
The question is, what are the causes of tinnitus? Because you mentioned noise exposure, and we've all gone to concerts and we've all been exposed to some loud noise from time to time, but that's not the only cause of tinnitus. So, what are some other things that might actually cause us to hear those phantom sounds?
Yeah, so anytime we take a case history on a patient that reports tinnitus, it's a pretty detailed case history in order to, because our goal is always to find what's causing it. Knowing the underlying cause allows us to then treat the underlying cause, and as a result, can likely help with the tinnitus that is manifested. So some causes, the most common cause of tinnitus, I would say, would be hearing loss. When I describe tinnitus to a patient, I always say, kind of in a simple term, tinnitus is a result of a change within your auditory pathway. So, any change within your auditory pathway that causes your brain to compensate for that change, and therefore it creates a sound. So that is what tinnitus in its essence is. So, most common cause is going to be some hearing loss, which can be, or for most people, is inner ear related, which is damage to the inner ear. But that's not the only cause of hearing loss. There's a lot of causes that are temporary, as simple as having impacted wax in the ear, an infection in the ear canal, an infection behind the eardrum, which is a middle ear infection, such as fluid, or with the small bones that resonate sound through your system. It can be a hole or perforation in the eardrum that causes some decline in hearing that as a result will cause tinnitus. There's something called Meniere's disease, which we talk about a little bit more from the vestibular standpoint, but it does cause a low frequency hearing loss, and as a result can cause tinnitus as well. And then, like we talked about, noise exposure. Sometimes it's not just noise exposure that happens over time, but a sudden burst of noise that might cause a sudden degree of tinnitus at that time.
Gotcha.
Some
Well,
other, sorry. Some
yeah,
other,
there's one thing that actually I wanted to ask you about, and I'm not sure if you're going to bring this up, but sometimes we get patients who experience a heartbeat type sound in their ears, right? A pulsatile type of a tinnitus. What usually causes that?
Yeah, so pulsatile or heartbeat, and sometimes even described as a whooshing sound, is more vascular. Sometimes it could be related to exerting energy, actually. So people will describe when they're working out, if they hold their breath and pick up a weight, exerting energy can change the blood flow. So it's related to blood flow in the ear. Sometimes it's a head trauma, or if it's pulsatile, we're always looking for other things that can be building up in the middle ear space. Something called a cholesteatoma can do that. But generally, I would say when I hear a whooshing sound, it is a change in blood flow in the ear.
Gotcha. Yeah. That's pretty common in our practice too. We do hear that quite a bit. So awesome. Anything else we want to add to the world of tinnitus right now?
Well, so I do want to get into a little bit of more maybe of other causes besides hearing loss, even though that
Sure.
is the most common. Some other causes can also be things like temporomandibular joint disorder, the joints, which is connected the lower part of the jaw to the skull. The TMJ joint or the TMJ disorder, the nerves running through the jaw are also running through the auditory system, so that can cause tinnitus, and as well as cervical spine abnormalities which affect ear vessels and or nerves that also run through the auditory system and can manifest into tinnitus. So when we take a look at diagnosing tinnitus or determining, the underlying cause, a case history, an extensive case history is really important, so we can not only dive into the hearing portion, but potentially any other contributing factors such as cervical spine and TMJ related issues. And then the full hearing test actually allows us to break down where the issue might be occurring so we can determine, again, the cause of the tinnitus.
Gotcha. Yeah, I think it's also important to note that the hearing test is definitely a very important component of this. We do want to document any sort of hearing loss, other things, and we talk about this in depth in other videos, and also have in the conversation you mentioned with Dr. Gans too. But sometimes we have to bring in other professionals to rule out anything that might be quote unquote serious, right?
Mhm.
So sometimes your physician, neurologist, ENT might recommend some imaging studies just to see if there's any growth on the hearing nerve itself. They might take a look at the cervical spine or the blood flow, as you were talking about with pulsatile tinnitus, just to see if there's anything going on in the head or neck that might be a contributing factor. So it is a collaborative approach. It's a team approach.
Mhm.
But the first step is definitely the case history and the hearing test, as you said. So
Yeah. It also allows us, I mean, I think what makes someone, I don't like to use the word expert in anything, but you know, diverse in tinnitus necessarily, knowing enough about it is the ability to break it down and then know where to refer to, because you can miss things like cervical spine or TMJ pretty easily.
yeah, yeah.
So,
And there's so much misinformation about out there about tinnitus that it's very easy for someone who's experiencing it, whether for the first time or for someone who has a more lasting perception of their tinnitus, to get completely lost and kind of run around the block many times trying to find something to figure out what's going on. Most important thing, as you're saying, is have a full hearing examination. And in some cases, we want a full medical examination, depending if it's bilateral, unilateral. In most cases, we do want a full medical evaluation regardless.
right.
That's the first step. So awesome information today, Dr. Zweig, as usual.
Thanks.
Awesome. So if you guys have questions out there, you can send them to info@newyorkhearingdoctors.com, info@newyorkhearingdoctors.com. And the other two videos that Dr. Zweig mentioned, I will make sure that we list them in the notes below this YouTube video with links, so you'll be able to check those out for more information on tinnitus and ultimately what we can do to help someone who's experiencing the symptom of tinnitus. So thanks again.